Andrea, a lactation consultant.
I'm Becca, I'm a pediatrician.
We'll be talking about newborn feeding.
Our goal is to have a pretty open conversation. We'll probably be about 15-20 minutes going through our slides, maybe a little bit more, and then we'll have plenty of time for questions at the end. If there's a burning question, definitely put it in the chat, and if it seems like something would be topical to address right away, we'll talk about it. Otherwise, we'll save a lot of our time for that at the end. Okay, so here we go, talking about newborn feeding frenzy, hunger cues, cluster feeding, and feeding stress. And I think this is pretty topical for most new parents. Just a quick disclaimer, I am a doctor, Andrea is a lactation consultant, but we are not your doctor or lactation consultant unless we are, in which case, hi. But this is for information in general, sharing of some educational information, not a doctor-patient or lactation consultant-patient relationship.
Awesome, so our main topics we'll cover today: what's normal for newborn feeding, hunger, and satiety cues, the most common feeding challenges. We won't go through every single thing in detail because we would be here for hours, but just touching on the main points. How to know if your baby's getting enough, really hot question. I was always wondering that. With breastfeeding, it's a big question mark here, so we'll go through all of those. Breast, bottle, or combo feeding, how to approach all of those and when it's needed, when to worry and when to get help, and a live Q&A at the end.
All right, so what's normal for newborn feeding? And I think this is really important to understand. This is a huge transition phase for babies. We have another webinar about sleep. We talked about newborn sleep is a big transition phase. Similar for feeding. They were in the womb, all their nutritional needs were met via the placenta, and now all of a sudden they're in charge of it, or we're in charge of it. It's a little tricky. So newborns eat a lot, and that is very normal. We're talking 8 to 12 feeds a day as our minimum, and sometimes it's a lot. I imagine most people here have heard of cluster feeding. We'll talk a lot more about that. It's pretty common. And feeding and sleeping are really intimately intertwined for babies. So there's a lot of feeding to sleep, a lot of suckling while half asleep, and that is, again, very common.
Great. Patterns of our tiny babies. Babies often feed right after waking. They can feed essentially nonstop, day and night time. The patterns are really messy. There's no schedule. The aim is not to make a schedule, especially early on. It's impossible. Again, as Becca was saying, like, they fed constantly in the womb. It was like a drip feeding essentially at all times. So it's really asking a lot for them to be able to space their feedings appropriately that fits our schedule. But we just gotta cope and do the best that we can. So the frequent feeding does actually help build our milk supply, especially early days. It's all supply and demand. So we need that frequent, effective milk removal and breast stimulation. If we're bottle feeding, then meeting their needs however they're needing to feed and requesting for feeds. Helps regulate their growth, makes them feel safe and secure, that attachment bonding that we're wanting to establish early on. And we want to use this time to really learn their cues and follow their needs. They're the ones that are going to tell you what they need, and their communication is not always straightforward, but there are subtle cues all along the way. So we'll go through that as well.
And I love this graphic.
Yeah,
I think this
too.
is so important. Yeah, so I think this infographic, which hopefully you can see, this is something that's really important because I think a lot of times in the hospital, we're told, especially as new parents, babies can't eat too much, don't overfeed them because their tummies are tiny. So that size of a cherry in that first day or so, but it gets bigger a lot faster, which I think is really important to understand. So if you are feeding your baby, you know that 5 to 7 milliliters as a 4-day-old or an 8-day-old, they're really not getting quite in that. And so it's we are expecting that increase in the supply as well as increase in how much a baby is able to eat happening pretty quickly, not immediately, but pretty quickly.
Yeah, and these are just guides. So all babies, this is a range of normal. So this is just like one kind of shot in the dark. But you know, if your baby still seems hungry and you've met this like higher number, keep feeding them more. They might be going through a growth spurt. We'll talk about this later, but you can't really overfeed a newborn. So we'll talk about that a little bit too.
So, is my baby hungry? This is something that for newborns, it's pretty subtle sometimes, and it does take a little bit of time to get to know your baby's cues. Most common you're going to see is a little bit of rooting, where they're like moving their mouth around, moving their heads around. They're just a little bit wiggly. Their hands are coming to their mouth if they're coordinated enough to make that happen. They're lip smacking. They're basically like, where's the boob? Where's the boob? Where can I put my face on a boob? I think oftentimes people, especially when you're exhausted, kind of maybe miss a little bit of that initial feeding cue, and then they end up crying a little bit, and that's what we would really think of as a later sign of hunger. And that can actually be frustrating because then they're upset, you're upset, and it's really hard to calm everybody down to have an effective feeding. But really picking up on those earlier cues is super helpful. I actually feel like for most brand new babies, they're awake, they're probably hungry. So just alertness is also something that is often a sign of hunger. Their bodies, when they're hungry, they're just moving. They're like, there's something going on. I'm looking for that breast or that nipple. And then when they're full, they're like, they're really relaxed and much more easy to console, just a happier baby in general. I think trusting your instincts is really important, but also making sure you have good guidance. So I think this is something where in the first few days especially, babies sometimes are sleepy but still need to eat. As your baby gets older, it's totally fine to follow their cues, especially once they're back over birth weight. That's great. But for when they are brand new babies and we're trying to really get milk supply established, sometimes it's just it's a stressful day. They got born. It's a lot going on. So they end up really needing to have a little stimulation to be able to get there, to get hungry enough and to actually get onto the bottle or the breast.
Yeah. I usually describe the early cues to look for is the quiet alert period. So when they're first looking around, like you were saying, like they're just like waking up to the world, just curious what's going on out there, and I'm about to start getting like more ramped up and more hungry. But if you can catch them at the earlier signs, you get a little bit more of a kind of a leeway to set yourself up for feeding. So look for those early quiet alert moments, and that's when you want to ideally start the feed. It's all good. I know we're wanting to nap until the very last point of time that we can to be able to actually feed them and waiting for them to stir or fuss a little bit more. You can do that too. It just makes it go a little smoother and less frantic, more relaxed if you start at the earlier hunger cues.
Yeah, and that's where having a support person can be really helpful because they can help get everything set up and get the baby ready to go and you ready to go. So everyone should know the hunger cues.
Nice. So common feeding challenges, as you probably know, which is probably why you're here, feeding is so much harder than we were prepared for. Oh my goodness, I had no idea how intense, all-consuming, back-to-back it was, and then add breastfeeding on, oh my god, so challenging. So we are here for you and we totally understand it's a lot. There's milk supply worries, there's nipple and breast pain if you're breastfeeding, bottle struggles, bottle refusal, trying to figure out what bottle, the positions, pacing. There's a lot to learn. It's a really sharp learning curve initially. And there's so many opinions and not enough support. So modern parenting is so hard because there's a lot of responsibilities and a lot of us are doing it solo. If you have a support person that's really in tune and helpful, that's amazing, but just still 2 people is not even close to enough, really, for everyone's needs to be met. Preparing ahead of time if possible, or just reaching out for support when you feel like you're at that point where you really need that is so helpful because it's a marathon, not a sprint. This is going to continue for many months of that really frequent feeding. The first couple of weeks is the most intense for sure, and we're healing as well. But long story, it's a lot. It's really challenging. We won't go through all of the common challenges, but just wanted to touch and validate that newborn feeding is really all-consuming. But you're not failing if you're struggling. This is just learning experience, and all of us learn on the job. Like no one went into this with their first baby or even subsequent babies. Like it's all different every time, but it can really feel like we're the only ones struggling so much. And I do also want to acknowledge some people do have more challenges than others, but it is just so hard. And eventually you're going to feel more confident. You're going to learn your baby, that communication. You're going to feel more confident. But it is so challenging. We are here for you though.
Yeah, and I think I want to just mention that's actually how we met, is because Andrea was my lactation consultant and I'm a pediatrician. I do this for my job. I have helped so many parents through the breastfeeding journey, and when it was my turn, oh man, the angle was wrong, if nothing else. It was like, I look at it this way. Yes, my son was wonderfully content to hang out on the breast for hours and hours and hours and do very little effective eating. Mm-hmm. So it took me by surprise. And again, it's my job. I do this all the time, and I've been doing it at that point for like over a decade, and still being on the other side as a patient, I think it's just really important to give yourself grace for this stretch of time. Most of us, I think it takes a little while for breast milk to start coming in. Bottle feeding can also feel really complicated because there's a lot of pieces to it, and we get a lot of pressure and a lot of opinions from many people in our life. So finding a support person that is your doctor, your connecting with a lactation consultant can be so helpful. And it's part of why we're so motivated to do this work with Coddle, because we want to be able to provide that support for people going forward. So yeah, we won't talk about all of these things, but we also do want people to know we have a couple of other webinars that we've done this past couple months. It's our summer series about newborn babies, and there's some great information on just breastfeeding 101 and also some really helpful information on pumping, which is part of many people's breastfeeding journeys, whether or not they anticipated that. Yes. Okay.
I find it so helpful for you to share your story as a pediatrician. And I was a midwife when I had my kids. The birth was definitely easier. Well, not easier. I was more prepared for it being a midwife, but man, feeding and breastfeeding is part of our training too, and I support a lot with breastfeeding as well. I think you supported feeding more than I did, but just want to say sometimes it's so reassuring to hear that even like experts, man, it was hard. It's so hard for everyone.
Yeah. So yeah, that's why we're here.
Yeah.
So cluster feeding, this is one of my favorite things to talk about because it's actually a really physiologically important thing that babies are doing. That, it's so hard when you're the cluster feeder. So babies go through these frequent bursts, usually the first couple weeks especially. I always tell parents going home from the hospital nights 2 and 3 are when I tend to see a ton of cluster feeding. And it's when your baby just wants to eat and then falls asleep at the breast, and 20 minutes later they're like, we're doing this again. Typically these sessions last for anywhere from 2 to 4 hours. They're not 24 hours, thank goodness. They do tend to happen at nighttime or in the later part of the day, and there's some reasons for that. So in the evening, most women who are breastfeeding, their milk supply is smaller, they have less volume, but it's actually a denser and richer milk. It's a higher fat content, but they're not filling their tummies in quite the same way. They're still a little hungry, but they're also hopefully pumping up to eventually be able to go for a longer stretch of sleep. I also worked with a lactation consultant who called it the pushing the delivery button. They're like getting more milk at a time when hormones are very responsive in this first couple weeks, and so it really does help build up a milk supply. It's also a comfort time. So this is something that often babies nurse not just to eat, but also to snuggle and to regulate their own physiology. It helps calm heart rate and regulate their temperature for them to be close to another adult. And that can feel really like a lot for a lot of moms. It is not a sign that you don't have a good supply for cluster feeding that we see, like you said, for that 2 to 4 hour mark. I will say that a baby who is never content on the breast, that is something that needs to be evaluated. Yeah. So cluster feeding, it's a cluster. It's not my wonderful son doing 20 hours a day on the breast and I'm eating. I guess he's eating, right? No, he's not eating.
You would assume.
I did assume.
Yeah,
I did assume. And then I went to see lactation and they were like, we gotta do some work on this. And we did. And then we breastfed forever. So I think just knowing this can feel really intense, it's temporary. I also want to validate, like, bottle feeding babies do this too. And that could be a little trickier. Andrea was saying it's hard to overfeed a baby, and it is, but bottle feeding, it's a little bit easier to feed past where they're ready. So really sussing out, are they sleepy and fussy, or are they really still hungry? And that's where knowing your baby's hunger cues is really helpful.
Yeah, and it takes some time to figure that out.
Absolutely.
Yeah. I like to say it's putting in the order for the next day. So it really helps like with that supply and demand. So your body really, it takes a little bit of time, but that frequent stimulation really helps your body get enough signals that baby is hungrier and you need to make more milk. We all hit a wall like in the evening time. It's a lot going through all of that during the day, and I think in the evening everyone's just feeling really overwhelmed, overstimulated, and I think just that calm, chill time where everyone just sits down, take a breath, have all your stuff in hands reach, like your book, water, food, whatever, so that you can just chill out for a little bit and just let them do that more frequent feeding. Again, I do want to say that it is not convenient time for everyone, and not everyone wants that, just sit down and just do nothing but feeding. But if we can just radically embrace that, if we are breastfeeding, that can really turn off that like fight or flight or the, is this normal? Oh, I hate this so much. But just knowing that it is so common, that it is gonna come, it can help us settle into it instead of fighting against it. But I also want to say, which we'll get to in a little bit, if you're feeling touched out or overwhelmed and you need a break, pump and bottle feeding is absolutely there as a tool that can be so helpful and just give you like a way out. It can help you just, I just need a little bit of time to myself. I'm feeling so overwhelmed. I have ADHD and I found myself like hitting into that so much where I was just really overstimulated. And this like radically embracing this sweet snuggly time was not what I wanted to do.
I also would say, like, when you have two kids and one of them is trying to go to bed when the other one is trying to cluster feed, it's a rough stretch.
So hard.
I am imagining. I have one kid,
Yes.
and it's already hard. So I think for parents, the second go around, your breastfeeding journey might be a lot smoother, but it also is more complicated because having often a toddler around, they're intense little people too.
Yes.
So I think just recognizing, like, cluster feeding is a normal part of the breastfeeding journey in particular, but it's also a really normal thing for babies to need to regulate too. So this is where, again, I think our message in all of our content is it's hard to do this by yourself. So it's so important to pull your team in close when it feels like, oh wow, I just need to take it. And I think after cluster feeding is a really important time, especially if you are breastfeeding, to take a minute, go take a shower, hand your baby off for a little bit. This is okay to just reset your body and take a little bit of time. I also want to mention, I think we're gonna hit there in a couple minutes. We definitely talked about this more in our previous conversation about breastfeeding, but cluster feeding, if you're having nipple pain, can be really uncomfortable. And so it is okay. You will figure out boosting your milk supply. You will figure out soothing your baby if cluster feeding is not available for whatever reason. So I don't want people to feel like, oh, it's this normal thing that can be really helpful. You have to do it. It's this normal thing that can be helpful, but if you can't do it, there's other ways.
For sure. Rest those nipples because we want to sustain breastfeeding.
Rest the nipples.
Yes, nipple rest for sure. I prescribe that all the time. Great. So setting yourself up for success, you deserve to have a really positive environment for feeding because it's so all-consuming and hard. Like, at the very least, we deserve to be somewhat comfortable and just in this really hard, intense time. So lowering the lights if you can, or even like opening a window or curtains, like something that feels really good for us. Like, all of these stimulations, they really can affect our mood. So having like a positive space that feels really good, even kind of resetting that space every now and then so you don't go in and you're just reminded of like all these things you need to do. Obviously take that off your plate and like delegate that to someone else if you need to or want to. But just having a positive and really like love inducing space can be really helpful during those times, especially if they're pretty long and no joke, like boring. Like sometimes the long breastfeeds, like I was bored and just like fun was there, but then it's just like Groundhog Day all the time. So it can just be like, oh, ready for this again.
Yes. Yeah. In like the booze cruise, we used to call it the boob snooze. The boob snooze was like, we're just hanging out, snoozing on the boobs.
Yes.
It's like, you're done? Okay. Oh no, you're not done. Okay, let me put you, nope, you're not done. And just accepting that was what was happening for maybe 2 episodes of Succession instead of just a few minutes. So I think that recognizing again, like, babies do really need a lot of snuggles, and that is okay, but you need to be comfortable too, because being all like hunched forward and trying to like football hold without good arm support or cross cradle hold, but you're like reaching forward in this way that puts a lot of pressure on your back, all of those things, they might work for a day or two, but that's not going to get you through your first month of breastfeeding.
Yes.
So I think this is where it's just so important to like, it's good to set it up, get your feet up, get comfortable, have your water, have your phone charger, have it all ready to go. Snacks, please eat snacks, very important. And I think this is also where we can recognize the joy of having our babies too, is like, that's part of why we have babies, right? We like to snuggle them. So the feeding can feel really hard, but that's where I think permission to make it in a cozy way that is going to feel good to you, especially if breastfeeding is hard. Because I think this is where we can get really self-punishing and we can get really unkind to ourselves if our body is not cooperating and doing exactly what we think it should be doing. And you know, that sometimes we're 7 in that bottle and like it's a relief to everybody, and embracing that as like relaxation that's available, I think is just so helpful. And I think it feels a little bit, I think because we talked about sleep and breastfeeding and pumping in other conversations, it feels a little bit like we're coming in this without quite as much context, but just remembering this really is a temporary state where your baby needs structure around feeding. They get way more efficient at it, right? You see a 6-month-old feed, they're like, I'm on, I'm off.
Yes. No help. The latch isn't really deep. They're doing great. No discomfort. Like, it changes so fast. The days and months are long, but the years are short. Like, it does change really fast, but it's hard.
Yeah, the beginning especially.
Yeah.
Okay, so this is one of my favorite slides. I really like how Andrea made the poops look. So one of the biggest questions, especially with breastfeeding, is my baby getting enough to eat? And so this is where, from a medical perspective, again, check with your own doctor, but to me this is super important to keep very close track of in the first couple weeks. After your baby gets back to birth weight, enjoy it, relax. Things are in a better spot. Of course, we're going to continue to monitor and pay attention to how they're eating and what's going on with pees and poops, but it's a lot less of the like super Hawkeye situation and feeling really stressed about it. I think hopefully people can start to feel relaxed. So from my perspective, the goal here is that we're going to see, similar to how that tummy gets bigger, we're going to expect to see more coming out of your baby in the first few days. So in that first like one day, babies usually pee and poop at least once in the first 24 hours of life, and then it starts to go up. Basically, 1, 2, 2, 3, 3, 4, 4, 5, 5, and then we're off to the races. And it's like, at that point, poops should get pretty big. There's usually a lot of fart poops, let's be honest. There's a lot of little squirty poops, but there should be at least a couple big ones and lots of wet diapers. Often parents will tell me, I don't even know how many wet diapers we're at. We just change them every time they eat. That's a great sign. Sometimes very early on, you'll see some like little kind of reddish color in the diaper. That's called urate crystals. That is a sign that the baby's flushing some stuff out of their system, but they might be a little on the dehydrated side. So it's really important if you see that to really check in on all the other feeding parameters to make sure that they're getting enough. And then you're going to see poops also change. So it's not just the quantity of poops that you're going to see, but also the color and texture. What a delightful thing to talk about. So when babies first poop, it's like really sticky meconium and it's pretty black. It's like very dark. Yeah. It's gross. It's all the stuff that's been in there since the intestines really developed and became intestines. So that hopefully clears out fairly quickly, but that can take 3 to 5 days to fully clear out. But really, once milk is in for breastfeeding babies and once like quantity of bottles is starting to increase, it starts to transition over to brown and then to yellow and to this like very pretty yellow seedy mustardy color.
Did you say pretty?
I did.
I love that.
I guess.
You're such a pediatrician.
I know, this is clearly I have very weird standards about what's pretty. But I think that there's a lot of colors that are normal. Some babies have orangey poops, a lot of babies have green poops. There's a lot of rabbit holes you can go down about green poops. Don't go down them. Green poops are pretty common. I don't want to see blood in the diaper. I don't want to see white or black stools or red with blood. So other than that, like there's a lot of normal here. And then I think we talked about, we want to see a baby that relaxes after they're done. If your baby is just unable to settle and really fussy, that's something you should absolutely be reaching out for some support. And the trick here, the reason I really pay extra attention in the first 2 weeks is because sometimes when babies get dehydrated or are not eating enough, they get not relaxed, but more like lethargic. Yeah. And so that's a really delicate line, and that's what we are here for. So that is when like most doctors want to see you and your baby within 2 days at most of going home from the hospital. This is where if you're worried, call your doctor's office. This is something that we don't mess around with because babies are really little and they can't tell us what's going on. It's our job to be the good detective observers and really make sure that we're getting enough into them so that they can continue to do their job of eating. And when you're really dehydrated and tired, it's actually harder and harder to eat. And so that can become a vicious cycle. We don't want that. But most babies are going to kick it up. They're going to be getting that 5 ml to 10 ml to 30 ml, and then pretty quickly by about a week, 1 to 2 ounces. And by 2 to 4 weeks, most babies are taking 2 to 4 ounces at a time. So that's also, if you're breastfeeding, that's a lot for your body to be doing. So this, once you're really well established with breastfeeding, one of the best ways to tell if your baby's getting enough is your boobs are really full, and then they're not. So that can be a really helpful thing to see. But I just want to also reassure people, if you don't feel that in the first couple of weeks of breastfeeding, that is super normal. That is really uncommon for people, unless this is your second or third baby, to really be able to feel that nuance, but you'll get there if you keep going with it.
Yeah. Great, awesome. So breast, bottle, or combo feeding. Love this topic. So there is no right way to feed. I'm a lactation consultant. I don't care. I'm here to support you, whatever your goals are, whether that's exclusive formula feeding, combination, exclusive pumping, exclusive breastfeeding, like whatever you want, we're here to support. And if you haven't found someone that's supportive in that way, reach out to someone else, because you are the one that's in charge of your body and how you feed your baby. So whatever you're doing is the right way, unless you don't want to be doing it, and then you can change your mind. Yes. But however you approach it is great. And sometimes, as we've alluded to previously, sometimes for lots of different reasons, we really do need to give baby a bottle, whether it's breast milk or formula. And usually if you have to do that, typically it's more of a short-term solution unless you decide to continue doing that. But sometimes physiologically we cannot do breastfeeding or we cannot produce a full milk supply, and there's lots of reasons for that. So if you're struggling with that, know that there are so many families in your boat. I have supported hundreds of families like that. So it's all okay. Again, it's all like a curve. So there's people on both ends of the spectrum, and there's a lot of space and support for you. So however you want to feed, whether it was your initial intention or not, like, you're doing a really great job. Keep going, you're doing awesome. And if you haven't got to your goals and you really want to, lactation consultants can be really helpful. Just make sure you find one that really support your goals, whatever they are. So there's no right way to feed. I went off on a tangent there, but no, I just love making sure that everyone knows that there's no judgment. It's just radical love and care and support for you.
Yeah, and I would say as a pediatrician, maybe 5 to 10% of my patients don't have a problem with feeding, which means that 90 to 95% of them do. And you know what? They do great. They eventually do great. I also try to remind people, like, the point of breastfeeding your baby is to get a kid who is big enough to not breastfeed anymore.
Yes.
So I think both of us breastfed, and it was a really important part of my journey as a parent. I also had my son a little older, and man, it took a long time for my body to be ready to just breastfeed. So I remember, I think my son was about 3 months, looking at the container of formula and being like, I think this has been open for a month and we have to throw it away. Oh my gosh, what happened? I finally got there, but it was a long time. And then my son breastfed. Not literally, he stopped breastfeeding, but like pretty recently. So I think this is something just so important to understand. I also really remind people, formula or express milk in a bottle is often a bridge to just get your baby through a stretch of time where the number one goal is them to get enough to eat and be hydrated, especially if your baby's jaundiced and they need to flush out some of that bilirubin. It's really important. And a lot of babies, especially if they're born a little early, they take a little while to figure out how to get on the breast and be effective and efficient in getting milk from the breast into them. And helping them along the way does not mean that you are going to never breastfeed or that you're going to be stuck pumping forever, but it's also really important to make the choice that's going to work for your family. And a lot of people actually really like to use bottles. Again, I like this idea of bottles are a tool, they're not a failure. But I also can say, as an older mom who worked really hard to have a baby, I cried and cried when I started formula. It was really hard. So I think I totally understand the emotional part of it. I'm also going to say hormones, man. Hormones are crazy. And then they make us look crazy along the way. So I think just really recognizing, like, this, I think, can feel like a really fraught decision. And I want people to fully feel from all of our professional experience, like, permission to do what works for you, and not just permission, but like encouragement, because there's a lot of ways to do this, right? I do think that we're going to talk in just a second about positioning for bottle feeding if you're also hoping to continue breastfeeding. But I think that the other thing I'll just mention is responsive feeding, which is where you're watching the baby's cues for both hunger and fullness, works with both breastfeeding and bottle feeding. And breastfeeding can be a really great way to bond with your baby, so can bottle feeding. There's something just very fundamental about feeding your baby, and using bottles opens up that bonding to other members of your baby's team and family. So just remembering that there's a lot of reasons that people just like to use bottles.
And just really quickly, I want to touch on, I'm so glad you mentioned it. If your baby is born a little early, especially before 36 weeks, they're called the great pretenders. Because they look, especially after 36 weeks, they look like fully developed newborn, maybe a little smaller for sure, but all their systems are like almost there. And you can watch them and it looks like they're doing a great job latching and feeding and maybe even hear some swallows. But then when you work with lactation consultant, we weigh them in grams before breastfeeding, you weigh them after, subtract the difference, that's what they're getting from the breast. When we do those weighted feeds with late preterms, it is so common for it to look like they did a really good feed. Really active, you hear some swallows, really good latch and jaw movements, and you put them on the scale and they gain 2 grams or 4 grams or 0 or even lost weight doing all of that work. And it is so discouraging. And I often ask people if they were told by people in the hospital like what to expect the late preterm, and 90% were not informed at all of how feeding can be different. And I find it such a disservice for families because they really do feel like they are definitely failing, or like they don't have milk, or they won't be able to breastfeed because they're really expecting, and people in the hospital are expecting them to right away latch and do good transfers. Just know that it can take until even up to 42 weeks adjusted age for your baby to really catch up and then start feeding and acting more like a full-term newborn. So give yourself a lot of grace and a lot of time and put all of those support people in place. to be able to make it to that point, and then have a little bit more realistic expectations, like past your due date, maybe 1 or 2 weeks past that. Yeah.
There's just a lot of neurological development. It's just coordination, like it's strength and coordination. And I would say, I think I've had one 37-week baby breastfeed without anything else.
Wow.
One.
Yeah.
In like 20 years of being a
Wow.
pediatrician. So
was she a first time mom?
She was. We saw
Okay.
each other for a prenatal visit, and I suggested doing a little bit of hand expression.
Yay.
Check with your doctor before you do this.
Yeah.
But some OBs are okay with this, and there's some good data to support it. But again, check with your doctor. Doing a little bit of starting with some hand expression in 37, 36 weeks, I think can sometimes really help stimulate that milk supply. And then you told her to start pumping right away, right? Yeah. So again, and I think again, most OBs are like, here's your baby, right? And then our team comes in a little bit late, and that transition team in the hospital can be so helpful and wonderful. And sometimes they're really busy and they don't have that like space and time to really sit and talk about like the difference between a 38-weeker and a 37-4 is, it can be a really big difference. So I think just understanding that's really normal. So I'm glad you went that.
Yeah, for sure.
Oh yes, so this is what we're going to talk about next in terms of like how to position your baby for breastfeeding. Oh, I forgot to tell you to get the doll. It's cool, but my arm is a doll.
Okay.
If you're on the breast, can everybody see my arm? Sit up a little bit. If you're on the breast and your baby is like in that cross cradle position, you're going to be holding them here, and their body is sideways, and see if I can get taller. Yeah, their body is sideways, and their face is like coming to the breast with no turn in their neck, ideally, so that they're not having to like swallow this way. That doesn't work so good. So when you think about doing a bottle, most of us think about feeding a baby like this, where you're like sticking a bottle in the baby's mouth right here. Yeah, that doesn't actually work that well. So what I like to have people do is this sideline position, where it really helps the baby be able to pace their own feeds, and it lets you see what's going on a little bit better, so that the baby's kind of out from you a little bit, and you're able to actually really see how they're latching. Is there a little puppy over there?
Yeah, or I can get my little baby.
Okay, yeah, let's get your baby. So I think when the baby is on your lap, you have them where their head goes towards your knee, and their head goes towards your knee, and you're going to give them a bottle of Andrea's chapstick, like this, as opposed to a bottle like this. So if you're feeding a baby like this and they get too much flow coming at them, they end up just not being able to do anything about it except for cough or choke. So they aren't able to pause their feeding if they need a break, which newborns really need a lot of breaks while they're feeding. So if you're holding a baby like this, it's almost like it's catching in their throat, and they have a harder time clearing it, and that can be like a much more stressful experience for babies. If you're able to put them like this, I found your chapstick. I thought the chapstick
Very
would work.
innovative. Love it.
So if you're able to put them like this, they're going to be able to get, oh, here's your baby. This is much better.
And all of my home visit supplies are in my car because I just did a home visit. So this is my bottle.
Yeah, it's awesome. So here's your baby having a bottle of fizzy water. Don't feed your baby fizzy water. But here we go. So the baby's going to be on your leg and this way. And then if the baby's overwhelmed by how much flow is coming at them, they can pause, put a burp cloth under their head, and they can just dribble it out of the side, as opposed to having it pool in the back of their throat or cause issues with feeling like they're choking and pulling back off the bottle but not really being able to get off because they're against your arm. There's nowhere for them to go if they're feeling that way. So I usually have people do side lying this way, and pacing for me, I recommend like tilting the bottle down a little bit, I think you can see, so that they're sucking on an empty nipple for 30 seconds or so, sometimes even a little bit more, and then slowly tilting the bottle up so that it's coming to their mouth and the milk starts to flow, much more similar to their experience on the breast. There's a lot of talk about nipple confusion. I think the biggest challenge actually from switching back and forth from bottles to breast is flow confusion. Spending that little bit of extra time that babies have to spend to not get instant gratification on the breast, teaching them that same method during bottle feeding, I think is really important.
Yeah.
What are your thoughts on this?
So many thoughts on this. Okay, love this because I talk about it all the time. I agree. Nipple confusion's not really a thing, but flow preference. So babies are creatures of efficiency. Whatever's easier, they can prefer. So if bottle feeding is so much easier right away, they get flow, they get constant flow, and they're done. 5 minutes. Why would they want to work 30 minutes, 40 minutes at the breast if they can just get it all really quickly? However, it does upset their tummy during that quick of feeding, but in terms of like their preference, they may for sure prefer bottle feeding if it's just so much easier than breastfeeding. So I like the side-lying paced position. If you see the pictures here, I was actually planning on replacing it with just one picture because I do totally think that's probably too small. I'm so sorry. Again, you can zoom in on that if you want. But if you look at the top left picture in there, I like to actually go, and everyone's different, I like your idea too, like perpendicular to your body. You have a pillow on your lap. I love that. It's usually really comfortable for baby and the feeding person. So pillow on your lap, put baby's butt all the way against your tummy. So usually they're a little bit lower, but just for the video, I'm gonna do right here. And then, so they're perpendicular to your body. So butt against your tummy, legs out. So like an L shape, like this. And then chopstick, I think is better. Actually, let's do it, yeah. And then the bottle stays pretty horizontal to the floor. So pretty in the same plane as like baby's mouth and their head. So just like this. And I also agree, like maybe right initially, if they're super hungry, you can give them a little bit of flow, but then maybe pace it right away. What I have found is that as long as the nipple is either full or mostly full of milk or fully empty, they won't be swallowing air, because I've definitely heard so many people, they're really nervous about pacing it whenever they're sucking on the nipple without flow. They're like, are they gonna gulp air? But same thing with us. If we have a dry straw, we're not like gulping down air. If there's a liquid there, we're swallowing. If it's halfway through and there's lots of bubbles, we can swallow air and liquid. But I would pace it down where they're just like on the dry nipple for maybe 10, 20 seconds. It could be less time too if they get really fussy. Give them a little bit more, and maybe 2 times through the feeding, more or less. Do another little pace. Again, not every suck can be a swallow. That can be really helpful. Because at the breast, your milk flows in letdown, so they have to stimulate the nipple first, then they get some flow, maybe swallow for a few minutes, then it dries up mostly, and then they're again sucking without much flow for a while, and then you get more letdowns. So mimicking the time-ish with bottle feedings to breastfeeding, and then pacing it can be really helpful. I say mimic the time because normally people breastfeed for 30, 40 minutes early on, but I would say a bottle feeding ideally is 10 to 20 minutes. So maybe not give them that many breaks, especially if they're getting really fussy and then crying. They can swallow air with that. So don't get them all riled up to that point and you're like, oh no, I gotta pace you. Like, I'm sorry, baby. And they're freaking out. Go with like their own cues and responses. And then as they get more used to it, then you can space that out a little bit more. But side-lying, pace feeding with a really slow nipple, giving them some breaks, either tip it down where they're just sucking dry, or if you're worried about that, just take it out 10 seconds or so, then give them a little bit more. But go with their pace and their temperament, essentially.
I think it's really helpful to watch your baby for this, because sometimes what I'll see in the office is that people will do these post feedings with really taking the baby fully off of the nipple, and then the baby gets super pissed, and they do cry more, and then you've interrupted the flow of their feeding. And so then it's a much more stressful experience. So I like that idea of just tip the nipple down a little bit and doing it not when they're like, I'm vigorously eating, but when they're I'm taking a little break. And especially if they're leaking a little bit, those are good moments to be able to just pause, slow it down for just a couple of seconds, let them get back into flow, but letting them lead the way for this, right? So I think similarly to on the breast, you put the nipple right there, you don't shove it in their mouth, you're letting them join the bottle as opposed to feeling like you're really trying to squish it in there. So I think this also to me is really helpful in the early days. This is really recommended by like occupational therapists, lactation consultants who work with preemies in particular, but I find it's really helpful for many babies in that first month or so of life.
For sure. So, yeah. Great. Perfect. So when to get help, first thing, trust your gut. If anything feels off or you just need to run it past someone, send your pediatrician a message, call the nurse line, call your lactation consultant. So reach out anytime things feel off or you just need that reassurance. No questions are too silly. Again, all of us learned on the job, and you are not ever going to be the first person to ask any question. So just reach out if you ever need any support or just some validation. If your baby is not gaining weight or gaining pretty slowly, your pediatrician will be on top of that. They will be giving you that feedback, but sometimes there's like days or weeks between appointments, and if things were already on the fence and you're not feeling settled, you can call your pediatrician and go in for quick weight checks between appointments. But weight, diapers, if the feedings are really long or really short, I do have a caveat to that though. If you have a lot of flow and your baby is just drowning in milk and they do not have a problem with gaining weight or diapers, if you feed in 5 minutes and your baby is satisfied and it's not too frequent of feedings, like, you're doing great. A fish a baby can drain the breast in 5 or 10 minutes, so it's possible. Early on, it's unlikely, But all that to say, if that's the only thing going on, you're doing amazing. That sounds great. Or if you're dreading every feed, essentially if you are just not having a good experience, if you're struggling with postpartum anxiety, postpartum depression, obviously the more severe symptoms like hallucinations or just really not feeling yourself, absolutely reach out and know that there is no shame or judgment in that. It's just like a hormone response or your lifestyle. Again, all the pressures that we were not meant to carry on our own. There's a lot of support for you. If you can't find it, keep reaching out. Reach out to us. We will absolutely connect you with someone. But you don't have to wait until like crisis or emergency moment to ask for support. Again, even if you're just like not feeling settled, that's one of the reasons we built the Coddle app, so that you can chat to it at any time and it should give you really helpful responses. Because all of those questions usually do come out of hours of pediatrician offices, or on the weekend or the evening when your lactation consultant's like not necessarily on call. So that's why we built Coddle, one of the reasons.
Yeah. And I think we have a reel somewhere about how to choose a pediatrician's office. One of the things I think is super important is your office should have a nurse triage available 24 hours a day. So if it is 2 a.m. on a Sunday and you ask Coddle and Coddle says, call your doctor, call your doctor's office.
Yes.
There should be someone that you can talk to, because we know that babies at this age are really a lot more vulnerable than kids as they get older. So in those first couple weeks especially, and definitely the first couple months of life, we're here for it. We expect it. And I actually worry more about parents who come to see me with 0 questions than I do with parents who have the list, because this is a new human. You're in charge of it. So it's important to pay attention and to have some ideas and questions about what you could do to help them along. So I think in terms of what we're hoping you leave with, one, a sense that there's a lot of support out there, and that babies, just the way their sleep is very unique and weird for a period of time, the way that they feed is very unique for a period of time. And this is usually the first month, and sometimes the first couple months. Cluster feeding is so normal. We also will frequently see that the learning curve is really steep, especially for babies who are born early. We want you to feel like, yep, we're going to feed as early and often as we can, however we can. Pumping along the way is really common. Bottle feeding along the way is really common. And just knowing what your own goals are so you can get the support you need to be able to feed your baby in a way that feels good to you. Really paying attention as you're learning, your baby's also learning. They get so much better at this really quickly. And your cues and rhythm of feeding starts to become something that is unique to the diet of you and your baby, and really falls into rhythm for most people within that first, I would say, 4 to 6 weeks. So it takes a while. It gets so much easier as they get older. There's new things that get hard, but this gets easier. And again, we're here for you, and you've got this. You're here. You're learning about it. You're doing your best to show up in a way that feels good for you and for your baby. And it just takes some time to figure it out. And for these newborn patterns that are a little frantic and a little all over the place, to settle into a rhythm that feels good and predictable to everybody.
Great. So resources, we're here. The app's there 24/7, as I mentioned. It's for these in-between moment questions. You can join our free Facebook group. It's Coddle Parenting Circle. We'll have a little QR code at the end that you can scan, and you'll see all of our links. But that's supposed to be a free resource, parent support, and all of our webinars will be there. Of course, book with a lactation consultant. Reach out to your pediatrician if you have any questions. Again, even if we're not emergency, that's why we're here, and we're all really passionate about supporting families. That's why we do this. So don't ever feel like you're a burden. You are the reason that we have this job, and we love it. And all of our previous webinars are on our YouTube channel, just at Coddle Parenting. Thank you. We definitely went over with this one. It's been the longest one.
Yeah, I think it was.
Yeah, so sorry. Totally. Yeah, it's complicated. Yeah. But we are ready for the Q&A, so if anyone has any questions, you can put it in the chat. We also had some ones that were messaged into us that we can read as well. Again, nothing is silly. We would love to hear from you. So a little bit on the screen about who we are, what we're doing, a QR code again with all of our links. You can also go to our Instagram, Coddle Parenting, and in our bio it has all of our links there.
And the Facebook group name is Coddle Parenting Circle.
Yep.
Thank you for asking. We'll hopefully see you there.
Yes.
Yeah.
So Danielle, baby Nico, said, is 4 ounces per feeding too much at 2 weeks old? My baby never seemed satisfied before that.
Yes, I would say this is where that chart from the cherry to the kiwi is really showing up for you. So 2 weeks of age, I think a lot of babies can take like anywhere from 2 to 4 ounces is pretty common. Definitely depends on if they're spacing out their feeds a little bit, have they gotten back to birth weight, but I think that's actually pretty normal. I will also say that babies do spit up more as they get older. So sometimes we think, oh no, we're overfeeding them, but it's actually just normal physiology. Their tummy stretches out, they become much more efficient feeders, and so they start to spit up, and that's pretty common. But if they're massively puking after 4 ounces, it might be a little bit too much. But if they're pretty happy and really comfortable with 4 ounces, great, that's totally fine too.
Yes, great. So Sarah says favorite bottles and nipple flow when you're breastfeeding. I have thoughts on this one.
Oh, let you take that.
Yeah,
one.
great.
Yeah.
I love my 3 favorite bottles. Just gonna get right to the point. Dr. Brown's Naramouth bottles. Love those. They're pretty common, easy to access, so those are pretty good. I would go for the preemie flow, even if you're full-term baby. Preterm baby for sure do preemie. But I like to stick with preemie or newborn. Newborn is a little harder to find, but you can find them sometimes at boutiques or on Amazon. They just sell out, and it's just hit and miss if they're available on Amazon. But preemie or newborn, even until 3 months old, it's a pretty slow flow. Yeah, but a lot of babies do really well on that one for that long. Level 1 is the next one after preemie and newborn. It is so fast for a newborn. So if you're breastfeeding, the flow of the breast is so much slower than level 1. I would say start with preemie or newborn if possible, and then go up basically when your baby seems to get really frustrated with the flow, or it's taking more than 20 minutes for feeding. Then you could try a faster one. If that's not it, because sometimes there's other things going on, then maybe go back to the slower flow and reach out to a feeding specialist or lactation consultant. I also love the Pigeon SS nipples. You can find them on Amazon. Love those. It's like the tapered shape. Lansino just recently came out with a extra slow flow. So Lansino and Pigeon are the same shape. It's just the Pigeon SS was a lot slower. So the Lansino slow flow is like a Dr. Brown's 1. So I like that after 3 months old. But before then, you could try the extra slow or the Pigeon SS. You can get it on Amazon. I also like even flow, but same thing with Lansino. It's pretty fast or slow flow. So maybe after a couple months old, you can try it, but otherwise stick with the slow flow, like tapered shaped nipples. Great.
And I can take this one from Jessica. My baby's almost 2 weeks old. I saw on one side that up to 4 hours between feedings at night is okay, but you were thinking more like 2 to 3 with occasionally every 4 hours. Is that okay? And he's gaining weight well. I'm glad to hear it. How long are we doing this on demand versus waking up? So this one is a decision that I recommend making in consultation with your doctor. What I tell my patients is that after 2 weeks of age, if your baby's still working on gaining weight back, we continue to recommend more frequent wake-ups. I usually have people still wake up their babies during the day actually for a little while just to try and get them set onto a rhythm. So if your baby is like super happy to sleep for 5 or 6 hours during the day, they're backwards and we need to switch them onto a better day and night schedule. So waking them up a bit more to feed during the day is great. But after they've regained birth weight, if they do that in a reasonable amount of time and they're gaining weight well, what we expect to see is that babies will then continue to gain about 1 ounce per day for the first few months of life. They're doing that and they're able to sleep for 4 hours. High five. That is great. So if you haven't had your 2-week appointment, which is a pretty standard appointment, then you should wait until that appointment confirms the weight gain. What are your thoughts about feeding at nighttime for breastfeeding and supply? Because I know a lot of women do decrease their supply if they stop feeding at night, and it's often one of the things I hear from my patients about they get their period back if they stop feeding at nighttime. So just wondering about that.
Yeah, if they're struggling to gain weight in the first couple weeks, and I'm usually every 3, maybe 4 hours if it's just a little slow. If it's pretty slow, then I say at night 3, during the day 3 is okay too, at least 8 to 12 times per day. By 2 weeks, if they're back to birth weight, then I usually say 2 to 3 hours during the day, 3 to 4 hours at nighttime. Sometimes it just depends on like how their supply is going, how engorged they feel if they stretch a little bit longer, but I'll sometimes say maybe like a 5-hour stretch in the beginning and then every 4 hours. But 4 is like the sweet spot that I found for the first month, but there's some outlier situations where again you have a lot of milk, you're really comfortable if you go longer, your baby is gaining and pooping and sleeping content, you can go like a little bit longer, but usually 3 hours during the day if they haven't cued earlier, 4 hours at nighttime if they haven't cued earlier, until at least 2 weeks, but sometimes the first month too. It just depends if baby's doing super well and mom has a lot of milk and isn't too comfortable. But if you're not breastfeeding at nighttime or needing to skip a feed to sleep, then you would want to pump sometime in the day to make up for that. But if you wake up engorged, definitely express relief. If you can sleep through that one feed at night, partner can bottle feed, you get more sleep, and then you can pump during the day to collect for that night bottle. That can be good too. Great, so I think we'll take one more question. Are pacifiers okay if breastfeeding Will it interfere with breastfeeding?
So my main thought about this is that in the very early days, if your baby is suckling, they're probably hungry. And so early, I think it's great to try and put them on the breast as much as you can for things like diaper changes, a little foot poke for a blood draw in the hospital if they have bilirubin issues, like those things. Soothing wise, it's usually totally fine to go ahead and use a pacifier, but popping a pacifier in when your baby's really little, you're often going to miss some of those hunger cues because so much of it is about what they're doing with their mouth. And so I would rather at least attempt to feed, and especially if you're breastfeeding early on, you just don't know how much they're getting. And so you can be like, oh, I just fed for half an hour and it seems like they're still sucking. They can't possibly need anything. Well, they could possibly need some. So I think in general, most babies can handle the switch back and forth. It's just that in those early days, I like to make sure that we're not missing hunger cues.
Yeah, same. So as long as you're not missing feeding cues, the best way to tell it is to offer feeding right before. If they just immediately conk out and fall asleep and they're not swallowing, then maybe you can switch it for the pacifier if you want to. So not missing feeding cues and the right shape pacifier. So my favorite one is the Advent Soothy, just like the straight round nipple. I don't like the bulbous ones or the flat orthodontic ones. Don't know what orthodontist made those pacifiers. OTs and other oral function therapists don't love those either. So the Advent Soothy ones, you can find them on Amazon, Target, everywhere.
Those are just ones in the hospital, right?
Yeah, if you were given one in the hospital, it was that one. Yeah. Essentially, it helps with the curling, cupping, lifting, extension. So it can help with the sucking and their tongue mobility. Just try not to miss feeding cues. When they're older and you know that they will tell you when they're hungry, which most babies do, but some don't tell you, and they're like, okay, I guess this is fine, and they drift off to sleep. But you should be seeing other cues like less diapers, pretty fussy, maybe not gaining well, or just really lethargic. Those babies, maybe hold off for a while until it's more established. Otherwise, I think it's totally fine, and it can be a really good tool.
Yeah, for sure.
Cool. That was so fun.
Yeah, obviously we have a lot to say about breastfeeding and feeding babies in general. We would love to hear your stories, and please come and find us on our Facebook group, like we said, Coddle Parenting Circle. We'll be doing a few more of these webinars over the summer. We'd love to hear if you have other topics that you think would be interesting to hear about from our perspective, both personal and professional. And please feel free to DM us or find us on any of our socials. And hopefully take a look at the app. We're building it for families, and we really want feedback on it. So this is something that we really wish we had, and I think are really hoping to create something that really holds families in all of these questions and can help the experience just feel like we're sitting with you and able to be there to support you. So.
Yes. Oh, thanks, Melissa. So sweet. This is why we do this, guys. We love it so much.
Yes.
Awesome. I hope you guys can join us next Wednesday, same time, same place. Go to our Instagram or any of our socials. The link in the bio always has this week's RSVP. Awesome. We're going to sign off for now.
Bye, guys.
Bye.